Hello Naturopaths Nation, Dr. Jessica Shoemaker here with a video to inform you of one of the most underdiagnosed conditions, hypothyroidism. The American Thyroid Association estimates that 20 million people suffer from thyroid disorders, but as many as 60% may not even be aware they have the condition because the symptoms are so widespread. Your thyroid gland produces hormones that affects how your body uses energy. This impacts all major functions, from metabolism to digestion, to heart rate and mental clarity, and can affect every organ system in your body. The reason I'm doing this post is because unfortunately, the standard thyroid screening most doctors use with their patients often miss some of the clinical markers of hypothyroid. The most common reason is that their testing only addresses the total hormone levels, but misses the free or bioavailable portion of T4 and T3, which is the only portion that directly communicates with your tissue. So in order to properly test for hypothyroid, you must request a test that measures the free components of thyroid hormone T4 and T3, not just the total. In addition, many physicians ignore thyroid hormone T3 completely. When patients present to our office with their lab work, I would estimate that over 90% do not have a T3 or a free T3 drawn. Why is that important? T3 is the most aggressive thyroid hormone that does the lion's share of the work related to metabolism and energy. Insufficient testing can be so disheartening to patients because although they have the symptoms of hypothyroid, their physicians tell them that they are fine based on incomplete labs. Specific nutrients like zinc, copper, and selenium are needed to convert thyroid hormone T4 into T3. So a low T3 that looks like hypothyroidism can actually be caused by nutrient deficiencies. These are not difficult to correct, but many doctors are not ordering the lab workups that would indicate that these nutrients are missing. Here are 3 of the most common signs that indicate that you might be dealing with hypothyroidism. Number 1, dryness. Dryness in stool, skin, or hair. Stool changes are sometimes the first sign a patient has that might indicate a thyroid imbalance. Hypothyroid manifests as constipation. That could be a dry, hard stool or a lack of urge to go on a daily basis. Changes in skin and hair, moisture, or texture are also subtle symptoms that can point to hypothyroidism. Many patients get drier in the winter months and often assume it's just a seasonal problem, and they can wait many months before looking for a deeper issue. Hair changes and hair loss are clear signs you need a thyroid workup. Number 2, weight gain. Thyroid hormones play a major role in our metabolism and our ability to burn food for energy and maintain an optimal weight. If you experience sudden weight gain that honestly seems to come out of the blue, you should consider your thyroid health. Unexplained weight gain is a classic sign of hypothyroidism. In addition, if you are implementing the same recipe of diet, nutrition, and exercise that has typically yielded weight loss results in the past, and this time around the same recipe has no positive effect, even though you're working your butt off, you need a thyroid workup. The third and final sign I'll mention here, and perhaps the most understood, is fatigue. Even though it is the most obvious and many patients know to consider their thyroid, they're often thrown off track when their primary care physicians run those limited labs I mentioned previously, and they leave feeling dejected and being told that they are fine. Oftentimes, patients can't decipher the difference between fatigue and depression because they feel so similar. If you suddenly feel sluggish all through the day, or you find you only have energy for work or the highest priority tasks, make sure you order a complete thyroid workup. In summary, dryness, constipation, undesired weight changes, and fatigue are all signs you might be hypothyroid. It's important to note that women are 8 times more likely to be hypothyroid than men. At Naturopaths to Wellness, we understand the inner workings of the thyroid and its relationship to other organ systems, toxicity, inflammation, and autoimmune disease. If you're experiencing any of these symptoms I discussed today, let us help you get to the bottom of them and bring your body back into balance. My message to you today is, if you don't feel like yourself, speak up. If things have changed for no apparent reason, get a workup. Don't settle for mediocrity. And definitely don't settle for minimal lab test workup that leaves you thinking you are just crazy or depressed. I really hope the information I shared today is going to empower you in your next physician visits. Thank you for tuning in today. Until next time, be well.